Welcome to Health Live at Seniors Today. Depending on which part of the country you are in, I'm sure the weather is taking a toll on, as it is taking a toll on all of us. I know it's in Delhi, it is a little past 50 degrees centigrade, and elsewhere in the country also it's bad. So please do take care of yourself. Keep hydrating yourself, and ensure that you have things cooling you off. Last week, we had a session where we had Dr. Chandrasekhar Kulkarni from the Nanavati Hospital in Mumbai talking about family history and how it impacts the heart care and hypertension and the like. And in the second part of our series on a similar thing, we have invited Dr. Mansi Munshi Girme to speak about genetic testing for cancer. Before I request her to speak, I'll introduce her. She's a radiation oncologist at the Ruby Hall Clinic in Pune since 2017. Prior to that, she did an MD in Radiation Oncology from the Tata Memorial Hospital in Mumbai, where she was a recipient of a gold medal for her MD as well as the Agarwal Gold Medal. While working at TMH, that is Tata Memorial in Mumbai, she also undertook a dedicated training in clinical cancer genetics and has experience in the evaluation of routine and rare hereditary cancer syndromes. She started a cancer genetic clinic here at Ruby Hall in 2017. She's an active member of the multidisciplinary tumor board at Ruby Hall Clinic and Oncology Group of Pune, and regularly participates in academic and teaching activities and conferences. She's been part of several clinical studies as well as national and international publications. She treats head and neck, gynecological, breast, urogenital, thoracic, gastrointestinal, neuro, spine, bone and soft tissues, pediatric, and hematological malignancies with radiotherapy. She also does palliative radiotherapy and management. Welcome to Health Live at Seniors Today, Dr. Munshi.
Hello, hi, thank you for the kind introduction. Thank you for having me.
It was something that we wanted to discuss on our Health Live series. And over to you. Tell us more about how this whether it's all in the genes that causes cancer, or is it also other than that? And and is it really possible to take care of in case it is detected that your genes have some traits which cause cancer, then what is it that people can do to ward off the threat? So over to you. And then those of you who have questions, please, as always, put them in the Q&A tab. And if you want to keep it confidential, not reveal your name, you can do that. And we will pose the questions to Dr. Mansi Munshi Girme after talk is over. Over to you.
Thank you. So, today's topic is about genetic testing. All right. So what do you mean by genetic? And we're going to be talking about cancer, basically. It's going to be all about cancer today. Now, all cancers are genetic. All right. All cancers have their origin in some sort of a genetic mutation, which causes a cell to go rogue. And then it starts dividing. It loses its normal kind of control, inhibitory mechanisms of the body escapes these, and it essentially starts dividing at an uncontrollable pace. Now, when I say all cancers are genetic, I don't mean that all cancers are hereditary. There's a difference, all right? So while all cancers have their origin in some sort of a genetic mutation, these mutations are not necessarily always hereditary. About 10 to 15% of cancers, we estimate, are hereditary, and they can be passed. The gene causing these mutations can be passed on from one generation to the next. And depending on which gene it is, we know it behaves in certain ways. Now, the remaining 85 to 90% cancers are sporadic, which means that they happen at random, by chance. You can say bad luck, or because of some carcinogenic exposure, like tobacco, as we know, causes aerodigestive, oral cavity cancers. We know smoking can cause lung cancers. So you either have a known kind of carcinogenic exposure, or it just simply it can happen to anybody. And what we're talking about today is those 10-15%, which there is some red flag which kind of alerts us that, is this something more than just bad luck? Is this something more than a sporadic cancer? Is there a hereditary basis to it? Now, what are these red flags? So the red flag could be an unusually young age of getting diagnosed with cancer. So for breast cancer, which is currently the most common kind of cancer amongst women in world over, and till a few years ago, it was it was the second most common cancer in India, but now it's the most common cancer. And for women, it would be about below the age of 40 to 45. We would consider young. Funny thing is, when I was doing my MD training, which is a little over a decade ago, when we had a woman in her 30s coming in with cancer, we would say that, well, unusually young case. All the residents would gather to see that, oh, such a young lady has got cancer, breast cancer. But now in my clinic, I see even women in their 20s. So I don't really know what's happening, but we're looking at about below 40, 45 as young. For colonic cancers, colorectal, we consider young as less than about 50 years of age. So age is an important factor. Certain types of cancer, like in breast cancer, if you have a triple negative type of cancer, that can alarm you. So any triple negative breast cancer needs to undergo genetic counseling and testing. If you have cancer in paired organs, like a bilateral breast cancer, or cancer in both the kidneys, for example, or you have a strong family history of cancer. So now when we're talking about family history, it's not just from the mother's side, it could be from the father's side too. If you're talking about breast cancer, we're not only asking if there's family history of breast cancer, it could be other cancers. You have to ask for all kinds of cancers, because sometimes you have groups of different types of cancers which could be related to one another. So we're looking at, like, I'm going to name them again: age, young age, family history, paired organs, bilateral, certain types of cancers, and certain unique types of cancers as well, like a medullary thyroid cancer. So even if there's one case in the family, we would want to evaluate these people. So once you have a suspicion in the clinic that this case could be hereditary, we need to do something called as a genetic counseling, in which we sit down with the patient and the family and explain what the implications would be of doing the test. So genetic testing is very easy. It's a blood test. The result takes about a month to come in, and it's a simple blood draw, and there are no kind of side effects to it. However, when you get the result, the patient and the family needs to be aware of what the implications of the result are going to be. On the treatment, on the emotional aspect, the psychological aspect, all of it. And trust me, it can have huge implications on the social well-being of the entire family. So this genetic counseling is extremely important. And then, of course, we do the genetic testing. And if it is indeed hereditary, then we again do a counseling to see what prevention can be done. So at the moment, we don't have any treatment to change your genes in clinical practice. So you can't change the genes that you're born with. Those are your genes, you can't change them, but we can take very good preventive actions. So the prevention could be not only for the patient in question, prophylactic surgeries sometimes, like the most common gene, which many of you may have heard of, is called as BRCA, which is BRCA. It became very famous because of Angelina Jolie, and it's related to the breast ovarian cancer syndrome. So patients with a BRCA mutation, you would see a lot of breast and ovarian cancer in such families, and typically triple negative breast cancer. So you could do prophylactic risk reductive breast surgeries. For a healthy breast, you could do an oophorectomy, that is removing the ovaries to reduce the chance of ovarian cancer. And if the patient doesn't want to undergo a preventive surgery, then screening and surveillance can be done in a high-risk way. So you may not be able to stop the cancer, but you'd want to catch it as early as possible with the best possible survival and prognosis. So this is, and sometimes it could impact your treatment as well, because certain drugs act better in patients with certain type of mutations. So it's helping the patient not only for him or her to prevent a future cancer, but also to guide their treatment options in terms of the type of surgery they're doing, opting for, or also the type of chemotherapy. And also, once you know there's a mutation, then we have to check family members, blood relatives, so siblings and children, and parents also sometimes, if the parents are young and haven't been tested, and then prevention for the healthy members of the family. So the impact is quite huge, and the aim and objective of this whole exercise is to prevent any further cancers, best treatment for that patient, and further cancers, not only for the patient but the entire family. So you've heard me talk a lot about breast in relation to hereditary, but there are all kinds of cancers that could be hereditary. So you can have hereditary syndromes related to colorectal cancers. So patients with there's a syndrome called Lynch syndrome, where you would see a clustering of young colorectal cancers, typically right-sided colon cancers below 50. You'd see endometrial cancer, uterine cancer in women in such families. They could be associated with breast cancer, urogenital cancers as well. So breast ovarian cancer syndrome and the Lynch syndrome, which is the uterine colorectal syndrome, these are the two most common we see in the clinic, but we also see a bunch of other rare cancer syndromes. And like I said, it could come from the mother's side, it could come from the father's side, and it generally, most of the common genes go from one generation to the next with a 50% probability. So it does not skip generations. It can go, if it doesn't go from the mother to the child, then it won't go any further. It's not that, it skips generations. That's a common misconception. And it could come from gender, looks and personality has nothing to do with it. So just because a child does not look like the parent who has cancer, that doesn't mean that they have a lesser chance. The genes which are related to cancer, hereditary cancer, have nothing to do with looks, gender, personality, or anything else. So until you do the test, you would not know. And we generally don't test children unless it's a particular, there's some genes which can cause childhood cancers, very few. But for the common ones that I've mentioned and that we generally talk about in the clinic, it very rarely impacts kids. So we would not test a minor. We would wait until they are mature enough to understand this fully, and then undergo testing after counseling. So that's basically the gist of the hereditary cancers in a brief overview. I'd also like to talk, since we're talking about a broad topic about genetic testing in cancer, I'll come to how a different kind of genetic testing can help treatment. But maybe we can pause here and take questions, because this is one big part which we finished.
Thank you very much. So we have questions. We have a question from Mr. Anil Chopra, who says, my wife, who's 70, is suffering from breast cancer, but HER2 positive. She has gone for 12 chemotherapy sessions, plus taken Herceptin 2, cancer right breast and auxiliary node, less than 2 centimeters. MLPA is okay. I'm not very sure that this question is right for this session, but her question is, what type of surgery is recommended and number of radiation needed? I would recommend that we don't really address this question, but because the topic is different. Shana Ravi asked a question: what are hereditary cancers? You did touch upon hereditary in the past. Can it be treated by lifestyle modification?
That's a very good question, actually. So the short answer is no. Positive lifestyle modifications are a good idea. So if you know that you have a tendency to get a particular type of cancer, then you'd obviously do all the lifestyle modifications related to that. For example, if someone has a tendency to get breast cancer, then they should keep their weight low. They should have weight loss, because we know that weight loss and exercise is scientifically proven way of reducing the chance of breast cancer. So it's a good idea to do that, but you cannot there's no data to suggest that any particular lifestyle modification can necessarily reduce your chances if you are carrying a gene, a faulty gene. So the only way to effectively prevent cancer, if you know you have a tendency, is to have a regular high-risk screening. So different syndromes have different guidelines and recommendations on what such people need to do. It's to follow these, visit the clinics regularly, and if that condition allows a surgical kind of prevention, then that can be discussed as well.
Right. We have a question which is, I guess, uppermost in mind of many people. How much does genetic testing cost? Is it covered by insurance? And an important question is, do insurance companies typically use genetic information? And are there any preventions? How does one handle it?
That's again a very good question. I've had both types of patients. I've had patients who policies have allowed genetic testing to be covered. I've had patients where it wasn't covered. Genetic testing in a standard lab would cost anything between about 20 to 30 rupees for a comprehensive panel for genetic testing. So it's a significant amount, but it isn't. When you're talking about cancer treatment in general, it's probably a fraction of the cost. Cancer treatment in general is quite expensive. But if the question is that whether it's covered or not, different policies, I've had different situations. Whether they use the genetic information, that's a very good question. They could. So I've had patients who have been refused their subsequent claims for treatment after the insurance company has come to know, it was a hereditary type of a cancer. So you have to be very careful kind of with this topic.
So the question that this person has just asked again is, do companies which conduct genetic testing reveal the information to insurance companies?
No, absolutely not. It's completely confidential. It's completely confidential. Unless you've used your insurance. So if you've used your insurance to pay for that test, then you've got to submit the results. So if you haven't used your insurance to do the test, then there's no way the insurance company is going to directly relay that information. Absolutely not.
Right. We have a question from an anonymous attendee who says, my mother, who's 75, had uterus cancer 4 years back, and my sister, who's 50, had breast cancer 3 months ago. Should I, who I'm 60, test myself for hereditary of cancer occurrence?
Yes, so a good question. So the person asking the question need not do the testing. The testing should be done ideally by someone who's had the cancer. All right. So when you're looking for a mutation, the chance of finding the mutation is highest when you test the person who's had the cancer. So we have 2 members of the family, one with a uterine cancer, one with a breast cancer, but both were postmenopausal. So they were not young cancers. So I'm not my index of suspicion is not very high for this family. But yes, genetic testing can be done, and ideally in a surviving member who's had the cancer. If we find that the test is negative, then we need not test any further. But if it's positive, then the person who's asked the question, so the brother of the patient or the son of the patient, then they can undergo something called as a family member testing to answer whether they have it or they don't. So yes or no question. All right. But I wouldn't recommend for the person to first go and test if they haven't had cancer.
Right. Thank you. We have a question from Mr. Basaraj Nagashetty, who says he's 67, presently in very good health. In his family, his father, 2 elder brothers passed away because of cancer. My father from lung cancer, my one brother from esophagus cancer, another from throat cancer. Even my grandfather passed away because of cancer. All have suffered only after the age above 60 years. His question is, what are the chances of him getting cancer? And if so, what are the precautions?
Right. So we're looking at a strong family history, but they're all aerodigestive tract cancers, and they're all in an elderly age. Um, Genetic testing can be done. Again, these kind of throat lung cancers, especially if any of these members of the family were tobacco users, so if many of them were tobacco users, then we would not think genetic at all. But if they were not, so can he answer that question?
Will you be able to answer this question, Mr. Basavaraj? If you can just put your response over here.
So we'll wait for his response. But while we're waiting, so what you could have is, there could be two things. One is that three things. One is that this is a complete coincidence that all of these people had cancer. There's nothing genetic to it. We could always test this individual and see. There's no harm in testing. But my index of suspicion is not very high, simply because we don't have too many syndromes which connect lung and throat cancer. It's usually because of some exposure, either tobacco or an environmental. What you could have sometimes is familial clustering of cancer, where it's not hereditary, but it's familial because of a common mental exposure. So you've had the father and the grandfather, the father, the siblings all having aerodigestive. So it's possible that they could have all lived or grew up in a certain area which had exposure to certain chemicals or certain environmental exposure. So sometimes you see clustering of certain cancers which are not hereditary.
So Mr. Basavaraj has not responded.
But we could do genetic testing.
Yeah.
But I've covered all the situations for him. And for an individual like this, it would make a lot of sense. Like your first person who asked the question, can lifestyle modifications help? So for a person like this who has so many members of the family having lung, throat, aerodigestive cancer, such a person should definitely be avoiding tobacco of all kinds. Such a person should definitely be, taking a lot of precautions, and should not ignore a new symptom like a persistent cough or throat pain or dysphagia and go immediately to the doctor. So,
but doctor, what does one do with such heavy pollution in our cities these days?
Yeah, is
that a problem of concern?
It's definitely a concern, not only for cancer, but so many other chronic health conditions, which are, allergies and COPDs, chest conditions, pulmonary conditions. We're seeing like never before. But I feel like the pollution is everywhere. It's inside us, it's outside us, it's what we're eating, it's what we're breathing. And we can control it only to a certain limit. So, we have to hope that the metro constructions and all the construction and development is everywhere right now in India. So it's very good on one hand, but it's also a huge price we're paying for all of us from health point of view. So I think the little things that as an individual can do is, you have filters for pollution. If you live in an area with high pollution, you have air filters you can invest in. You have air filters in the car, for the house, and avoiding processed food, avoiding eating seasonal fruits. So don't eat fruits which are not seasonal. So you're avoiding harmful chemicals which could be in the preservatives. These are things that I'm sure most people do anyways. Avoiding plastics, so drinking water in a steel bottle rather than having plastic bottles at home. These are small things we can do. And then screening is important for a healthy individual. So we've spoken so far today all about high-risk individuals with hereditary syndrome. So for the average patient, for the average person who doesn't have such family history or anything, they still need to have screening. So all women above the age of 45 need to have a mammogram once a year. All women above 21 need to have a pap smear once in 3 to 5 years. All men, PSA is another topic for another day, but that's another screening that men can do. So I think we have to kind of take health in our own hands.
Right. Doctor, we have a question from Mr. Akori Kumar. Says, my wife passed away with breast cancer. She has ERPR negative and CERB2 positive at the age of 52. What precautions should his daughter take?
Okay. Sorry about that, Mr. Kumar. Your wife had it at 52, so postmenopausal HER2 positive breast cancer. If it's the only case in the family and there's absolutely no family history at all, then I would not want your daughters to undergo genetic testing. It's not indicated. But if there is a family history from your wife's side, then sure, your daughters could have counseling to explore that option. In terms of precautions, they would just need to do what all women need to do. So mammogram after 45, once a year, of both the breasts, self breast examination every month. All women should be breast aware. So if they feel a new lump or a new kind of a skin change or a nipple discharge, then take it to the doctor's notice immediately. So to put it short, your daughters just need to do. If there's no family history in your case, then your daughters need to just do what all women need to do.
Right. Thank you. We have a question from Lakshmi Kumari, and she says, my sister was having high estrogen levels. Should I get tested? This is, she has asked a question earlier as well. So should she get tested because her sister was having high estrogen levels?
So high estrogen levels without cancer, just high estrogen level?
Well, she's not mentioned anything.
Do you know that? Not mentioned. So high estrogen level, so women who have PCOD, for example, PCOS, which is a common kind of a condition these days amongst women, have high estrogen levels, and that is kind of factor for certain, like breast and endometrial cancer. But there's no genetic kind of thing over there happening. So just high estrogen levels, we don't need to do any genetic testing. But individuals with a high estrogen level should be more careful about other lifestyle modifications.
Right. Thank you, doctor. I think we've done with most of the questions. Well, one more. Are these scans safe for repeating every year? But that's a question which somebody else has asked as to how often should you do this genetic testing? Is it important to do it often enough, or is it just once?
No, it's
enough?
the once. It's just once. And again, I'm going to repeat, I don't know if I was clear about this earlier, but everybody does not need to undergo genetic testing. This is not optional. This is not something that you can walk into a lab and get your genetic testing done. All right. It should not be commercialized in that way at all. Genetic testing should be done only for individuals and families where it is indicated after genetic counseling is done by an expert, so that it's done only if required, and it's done after all the implications are understood. And if it's done, then it needs to be done only once, because your genes are not going to change.
And is genetic testing done in most hospitals which have some cancer wards these days?
So genetic testing is in most hospitals outsourced. There are few companies in our country which are the kind of the big names, and they're tried and tested. They have a lot of personal data, and data is really important when you're doing genetic testing, because you need to know what the test result means. You need enough Indian data to compare it with. So there are a couple of such labs. Most of the hospitals outsource it to them, but some hospitals, more and more hospitals, are now testing in-house in themselves. And there are a lot of smaller labs coming up as well now. So another very important point is, if someone is doing genetic testing, then they should make sure that the test is being done at a certified, tried and tested lab. Because the last thing you want to do is to have a confusing result and get treated or have some kind of action taken on a report which can't be trusted.
And how does one know that this is a certified lab? Because for a layperson,
because you don't need to approach the lab yourself. You need to get a genetic counseling done with an expert, and then they have to guide you to the right place. So it's your oncologist, it's the people concerned are your oncologist and the genetic counselor. So that's usually should not be the patient's choice to walk into a lab and have a genetic test, not at all.
Right. Doctor, this is a question from Katie Dadanchi, who's 73. She asked, Doctor, if my grandfather had cirrhosis of the liver, my maternal uncles had pancreatic cancer and liver, should I take any precautions in my 70s, though my mother and sister have had no cancer? And is it necessary to do a mammogram as it is radiation?
So two separate questions. The first answer is I don't think, it doesn't seem that genetic testing is required in this family at all. The second question is about mammograms. So mammograms are safe, and there is a very small radiation exposure with a mammogram, and there's a lot of data and a lot of studies which have shown that it's perfectly safe. The cumulative radiation dose that you would have, even if you had a mammogram every year from 45 to 75, it's safe. All right. At 73, if she wants to start having breast screening with mammograms, is again something she needs to discuss with her healthcare provider, because the risk of breast cancer as such, if you look at it as a graph, the risk kind of plateaus off after about mid-70s. So even the guidelines for normal population average risk screening, it's you need not do it after mid-70s. So that's a personal choice that she can take.
Right. Doctor, we have a question which I've just received on SMS, that in big cities you might have these things available very easily, but what about small cities? Where can one go to for genetic testing? We have hospitals, we have fairly advanced hospitals, but should one go for genetic testing only to a big city and be sure that it's safe and sound?
Good question. But so these labs that I mentioned, I'm not going to take any names, but these labs, the ones that are kind of very standard, they can do sample collections even from the smaller cities. So just because somebody lives in a smaller city does not at all mean that they wouldn't have access to this. It's just a small kind of EDTA tube in which the blood is collected and sent, and it's centralized. These labs are centralized, so the sample would go to another city for testing anyways. So the place where you live has nothing to do. It can be collected from smaller cities as well. That's not a problem at all.
I think we're done with most questions. You were going to be talking about something else.
So to cover about genetic testing, so what we spoke about so far was testing for germline mutations, which are connected to hereditary cancers, and it's more about prevention. Now, somatic mutations, when I started off the webinar, I said that 90%, 85 to 90% of the cancers are sporadic. And they also have mutations, but these mutations are local mutations within the tumor. They're not mutations which are going to be passed on. They're not present in the other cells of the body. They're just present in the tumor. So these are called somatic mutations. And you can even do genetic testing on the tumor tissue. So earlier, when we talk about germline hereditary mutations, it was a sample collection was the blood of the patient, because every cell in the body has the mutation. It's germline. But when you're talking about somatic or sporadic cancers with somatic mutations, then we do genetic testing on the tumor tissue, on the tumor blocks. And these results can also give us a lot of information on personalized kind of precision medicine, we call it chemotherapy. So, targeted medicines, whether they can be used, and that's very, very beneficial in many cancers. The success stories are lung cancer, kidney cancer, so many other types of cancers. So lung is the main kind of maximum data, but in many cases, especially in stage 4 metastatic cancers, this kind of testing can really help to guide the medical oncologist choose appropriate targeted chemotherapies and targeted therapies to treat the cancer. So there is a role for genetic testing even on tumor tissue, but that's a completely different topic. And I just wanted to touch upon it so that it's out there, the information. So if there are any questions on that.
Yeah, sorry, thank you very much. We have a question which has been, which I kind of dismissed because I thought it was not, relevant over here, but he has requested that it be asked. This is from Mr. Prakash Jaktiani. He please inform symptoms of colorectal cancer and any reason associated with this cancer.
Okay.
And is it associated with constipation?
Okay, so it's not really associated to constipation. but constipation could be one of the symptoms of a colorectal cancer. So your question was, what are the symptoms of colorectal cancer? You would have bleeding, visible bleeding in the stools. Sometimes you would have invisible bleeding in the stools where you don't see the blood, but you have a drop in hemoglobin. Over a period of time, you feel weak, breathless. You check your blood counts and you find your hemoglobin is unusually low. The next step would be to check if there's occult blood in the stool, whether any microscopic blood loss is there. The next step would be to get a colonoscopy to check if there's a growth. The other symptoms would be a change in bowel habits. If someone has a regular bowel habit and then suddenly has loose motions or suddenly has constipation, sometimes it could be alternating loose motions and constipation. So any change in bowel habit, bleeding in stools, sudden weight loss, these are the common symptoms of colorectal cancer. Why it happens also, he asked what is the cause of this cancer? So we spoke about the small percentage, 10% could be hereditary. But the rest of them, it could literally happen to anybody. There is some data that excessive red meat consumption could be linked to colorectal cancers. And usually in the Indian diet, we don't consume a lot of red meat regularly. You know, and most in an average Indian household, non-vegetarian household, you'd have red meat once a week or once in 2 weeks or less. So we don't, there are other communities in the world where they have very regular red meat consumption. So it's probably more applicable to them. Smoked foods, again, is not very commonly eaten in our culture. So yeah, that basically covers the common etiology, risk factors.
Thank you very much, Doctor, for this session. I think the fact that you've had so many questions also does indicate the kind of ignorance levels that are there, or people wanting more information. So it was really good that we conducted this session. Thank you very much once again for taking time off for speaking to our readers. So as always, we will be back once again next Saturday at 5 p.m. for another session of Health Live at Seniors Today. Do remember the Evergreen Club, which exists, and you have three sessions every day, and you can attend that. And the Health Seniors Have Talent starts on June 5th, so you can attend that as well. Thank you very much.
Subscribe now and press the bell icon. Never miss an update.